This video presents a demo of the simulation of drug effects in cellular and 3D cardiac models, one of the 3 use cases within the European project SimCardioTest. In this study, 3 partners collaborate to assess drug safety and efficacy. Exactcure provides pharmacokinetic models, UPV has the know-how of the electrophysiological activity, and Simula contributes to the mechanical simulation of the heart. Following drug intake, a compound is absorbed, distributed, metabolized, and excreted by the body according to its pharmacokinetics. To maintain a safe concentration exposure, it's crucial to reach the minimum therapeutic threshold and avoid toxic levels. Pharmacokinetic models are specific for each molecule and allow to simulate plasmatic concentrations from the dosing regimen, taking into account the contribution of key patients' characteristics. To assess drug effects, plasma concentration is introduced as an input to electrophysiological models of cardiomyocytes. The molecule interacts with one or several ion channels and modulates transmembrane currents, leading to electrophysiological changes. We distinguish between male and female populations. During drug safety assessment, for instance, the fatty light effects of the same posology on action potential differ between population groups. Indeed, a larger prolongation in females can lead to early after depolarizations, a precursor of torsade de pointe at the cellular level and an indicator of arrhythmia risk. Additional patients' characteristics, such as impaired renal function, can worsen the electrical activity. Apart from assessing risk, simulations can also suggest the optimal therapy considering several patients' characteristics. In this case, a reduction of the posology would reduce torsade de pointe risk in females with renal dysfunction. To simulate the whole heart, volumetric cardiac meshes are built from computed tomography and magnetic resonance images from a patient's torso. Firstly, a manual segmentation process allows to obtain the heart geometry with highly detailed anatomic features, but also other organs and structures that comprise the torso, such as the bones and the lungs. Secondly, both the ventricles and the atria are separately meshed with a fine spatial resolution composed of hexahedra, while the torso volume is meshed with a lower resolution, with tetrahedra. The next step consists of applying an isotropy to the cardiac muscle by introducing fiber orientation and labeling different electrophysiological regions. Electrophysiological simulations show the electrical activation pattern. For that, we implemented a Purkinje network by means of an optimized algorithm to reproduce physiological ECG morphologies. The biventricular mesh is fit into the torso mesh to simulate the electrocardiogram. Drugs, such as dofetilide, can delay the electrical repolarization of ventricles, corresponding to a prolongation of the QT interval of the ECG. This is an indicator of torsade de pointe risk. When assessing efficacy, the objective is to find drugs able to improve the altered electrophysiological behavior caused by a cardiac pathology. In atrial fibrillation, abnormal electrical impulses, known as reentries, cause an irregular heart rate that overrides the natural rhythm. An effective drug should be able to terminate the reentry to recover atrial function. Myocardial ischemia occurs when blood flow to the heart muscle is obstructed by a partial or complete blockage of a coronary artery. Structural and electrophysiological remodeling occurs during the acute phase of ischemia, and within the first 5 minutes, the vulnerability to develop electrical reentries increases, compromising heart performance. Pharmacological treatment with an effective drug could avoid reentry formation by reconditioning myocardial electrophysiology. Pathologies that damage the heart muscle can cause heart failure in the long term. To simulate the loss of myocardial contraction, we included mechanics into the electrophysiological model. Initial tests are being performed on a ventricular slab mesh. Both electrophysiology and mechanics are computed on the wedge, and it shows an impaired activity caused by heart failure-induced remodeling. Inotropic drugs are effective due to their ability to increase contraction, and the lacking effect on electrophysiology could prevent electrical instabilities. The final objective is to have all models and software of the pipeline in a cloud-based platform, a tool on which InSilicoTrials is working on. This will facilitate access to users who want to perform safety and/or efficacy studies to simulate drug effects in population of patients so that results will be obtained faster than in regular tests.